Good morning, all the participants and my colleagues here. I think I'm humbled by the introduction given by Dr. Apoor. And in the next 2-3 days, you will realize that I'm not what he is saying.
More than that.
But coming to the subject, that why we are here, why I am here, and why you are here. We at Conceptual Orthopedics, when we conceived this platform, we were thinking of reaching to the masses, the students all over the country, because we felt that there needs to be a standardization in teaching orthopedics or any other subject. And the best way to, because the technology is available now, and we could do our bit. But over the years, as the program grew, we felt that probably virtual cannot match the actual. And that is why we felt that if we can get some students who are able to come, who are able to travel, because as it is, there are so many postgraduate courses now being conducted over the length and breadth of the country. But for our subscribers, if they can come down to Delhi, then let us start physical courses. And we started them. And then this center came in. The need for the physical interaction with the patient is supreme. It cannot be duplicated by any other modality, whether it is audio-visual or whether it is imaging or whatever you may say. The amount of information that you get to physically interact with the patient. To give you an example, if there is a paraplegic who's brought in on a stretcher or something, you can smell that this patient is incontinent. You can smell. Can you reduplicate this on any audiovisual modality that you get? Tenderness. If you elicit tenderness, the patient winces. Yes, you can probably show it on audiovisual, but to have the actual experience is what makes it different. Movement. You may show movement, you may say there is crepitus, but unless you get the knack of feeling that crepitus, experiencing it yourself, you will never be able to make it out. So these nuances of physical examination, I think, cannot be reduplicated. There is a growing trend we are seeing in our practice. When patients come, these days, some patients come to us for second opinion. Because I was in a public hospital, and there is always a dilemma that if you are going to a private practitioner, he may be doing something for economical reasons. Okay? So patients do come as for a second opinion. And when you examine them, some of them remark, "Doctor, I've been to 2 doctors, 3 doctors, but none of them put his hand on me." So this is very unfortunate, because I believe an X-ray or an MRI scan or a CT scan these are shadows. These are shadows. Can you recognize a person by just looking at his shadow? It is so simple as that. You will have to look at the person and look at his shadow, and then probably if you correlate the two, that is how you can recognize that person. So this is as simple as that. I would not make it complex. I think that is why we are all here, to have the real experience, and I hope in the next 3 days you will enjoy it. Thank you very much.
Thank you, sir.